If you've been rubbing red pepper on your feet to stop that burning, I want you to stop what you're doing and watch this. Because there's something happening inside your nerves right now that no one has explained to you. And once you understand it, everything is going to make a lot more sense. I've been working with patients over 60 for decades. And I can tell you, the people who come to me after trying that red pepper seed trick are not wrong for doing it. There's actually a real reason it works. The capsaicin in red pepper temporarily depletes a chemical in your nerve endings called substance P. That's the chemical your nerves use to send pain signals to your brain. When you apply capsaicin directly to the skin, it overwhelms those receptors, exhausts them, and for a few hours, the burning quiets down. So yes, there is real science behind that. And I don't want you to feel foolish for trying it. But here's what I need you to understand. What that trick cannot do, what nothing applied to the skin can do, is reach the underlying nerve damage. While you were sleeping last night with some temporary relief, the real destruction continued. Quietly, progressively. And that is what I want to talk to you about today. Because what most people over 60 with this kind of burning, tingling, and numbness in their feet don't realize is that there is a specific biological mechanism behind it. A mechanism that most doctors never explain. A mechanism that, when you understand it, changes everything about how you approach this. Stay with me. What I'm about to share could genuinely change the course of your health. I want to ask you something, and I want you to answer honestly, just to yourself. Do you wake up in the middle of the night with your feet feeling like they're on fire? Like someone pressed burning coals against your soles and you can't escape it no matter how you reposition? Do you lie there in the dark, 2 or 3 in the morning, just waiting for it to pass, knowing it won't? Do you walk down the hallway and reach for the wall? Not because you're weak, but because your feet don't quite feel like yours anymore. There's a numbness there, a disconnection, like you're walking on cotton. And then during the day, maybe you're sitting quietly and suddenly there it is. A jolt, an electric shock shooting through your foot or your leg with no warning whatsoever. No cause, just pain. And it passes. But you know it'll come back. Maybe you've stopped wearing certain shoes because the pressure is unbearable. Maybe you've stopped walking in the evening because you're not sure you can trust your balance. Maybe you've quietly stopped doing things you used to love. Gardening, dancing, walking on the beach. Because the combination of pain, numbness, and fear of falling has taken them away from you one by one. I've seen this in thousands of patients. And I want you to know something critical. This is not simply aging. This is not something you have to accept. And it is absolutely not your fault. In my years working with patients over 60, I've seen this pattern over and over. Someone notices the tingling. Maybe the burning starts. They go to their doctor and they hear one of two things. Either, this is normal for your age, or they walk out with a prescription for gabapentin or Lyrica. And for a while, maybe it dulls things a little. But the side effects, the foggy thinking, the dizziness, the memory problems, they make daily life feel like moving through water. And the moment they miss a dose or try to stop, the nerve pain comes rushing back, often worse than before. So you tried things on your own. You tried the warm foot soaks. You tried the red pepper. You looked online at 1 in the morning because no one gave you a real answer. And I want to tell you right now, I understand that. And I respect it. You have been trying to take care of yourself because the system wasn't doing it for you. But here's what makes this even more serious. And I'll get to the full picture in just a moment. Because what's actually happening inside those nerves is something that, if left unaddressed, doesn't stay the same. It progresses. And the window to meaningfully support your body's ability to recover narrows over time. That is the part that keeps me up at night when I think about my patients. Let me explain what's actually happening. Think about your peripheral nerves, the ones running from your spine all the way down to your feet and fingertips, as electrical cables. Cables that carry signals in both directions, Your brain sends a signal down. Move this muscle. Do this. And your feet send signals back. This is hot. This surface is uneven. I need to adjust. Every one of those cables has a protective coating, an insulating layer. The scientific term is myelin, but think of it exactly like the rubber casing around an electrical wire. When that rubber is intact, the signal travels cleanly, instantly, accurately. But when that casing starts to break down, the electrical signal leaks. It distorts. It fires when it shouldn't. It doesn't arrive when it should. And that, right there, is what you are feeling as burning, tingling, numbness, and those sudden electric jolts. The question is, why is the casing breaking down? And this is where the research gets really surprising, because the answer isn't primarily age. The answer is something far more specific and far more addressable. The production and maintenance of myelin, that protective coating, depends critically on one nutrient above almost all others: methylcobalamin, the active, neurologically bioavailable form of vitamin B12. And researchers have documented something deeply troubling. After the age of 60, the stomach's capacity to absorb B12 from food drops dramatically. The cells in your stomach lining that produce something called intrinsic factor, the protein required to extract B12, begin to decline. So even if you're eating well, your body is absorbing a fraction of what it needs. And if you're taking metformin for blood sugar, which millions of people over 60 do, that drug actively blocks B12 absorption at the cellular level, not as a side effect that's widely communicated, as a documented, published pharmacological mechanism that most patients are never told about. The result is a progressive, accelerating deficiency of the single most important nutrient for myelin production. And the nerves, starved of what they need to maintain their protective coating, begin to degrade. But that's only the first layer. Researchers have observed a second mechanism running in parallel, something called neuroinflammation, a low-grade, chronic inflammatory state that specifically targets peripheral nerve tissue. It's not the inflammation you see when you sprain an ankle. It's systemic. It's quiet. And it's been associated in published literature with oxidative damage to nerve cells that accumulates over decades. Your nerve cells have their own internal power plants, mitochondria. And oxidative stress, over years and decades, degrades those power plants. Damaged mitochondria produce less energy, and nerve cells without adequate energy cannot maintain themselves, cannot repair themselves, cannot sustain the myelin coating that keeps signals clean. Remember what I said about the red pepper seed trick? Here's why it only scratches the surface of what's really happening. Capsaicin can intercept pain signaling at the skin level, but it has no mechanism, none, to reach the myelin. No mechanism to restore B12. No mechanism to reduce neuroinflammation or reverse oxidative damage inside nerve mitochondria. The electrical wire is still degrading, and the relief when it fades leaves you exactly where you were. Researchers at institutions studying peripheral neuropathy have published findings over the past 2 decades that most clinicians have largely not integrated into their practice. Studies examining the specific relationship between methylcobalamin, not the synthetic cyanocobalamin form found in most cheap supplements, but the active methylated form, and nerve conduction velocity, have shown measurable effects on the electrophysiology of damaged peripheral nerves. Meaning, when patients with documented B12 deficiency and peripheral neuropathy were given adequate methylcobalamin supplementation, the speed and accuracy of nerve signal transmission began to change. The myelin, given what it needed, showed evidence of recovery. The clinical evidence points to something the body does naturally when supported correctly. And that is the part nobody is telling you. I had a patient, I'll call him Thomas, 71 years old. He came to me after 4 years of worsening neuropathy. He'd been on gabapentin for 2 of those years. His words: "I feel less pain, but I also feel less everything. I can't think straight. I can't remember words. My wife says I'm not myself." He'd tried vitamin B12 supplements. the kind from the drugstore, and felt nothing. He'd tried capsaicin cream, he'd tried compression socks. He was starting to accept that he would spend the rest of his life unable to feel his feet. What we found when we tested him was a profoundly depleted methylcobalamin status, despite the fact that he was technically within normal range on standard blood work. Standard blood work measures total B12. It does not measure whether that B12 is actually reaching nerve tissue in its active form. And Thomas had been taking cyanocobalamin, the synthetic form, for months. Cyanocobalamin must be converted by the body into the active form. In many people over 60, that conversion is impaired. The supplement he was taking was essentially inert for his purposes. We also found significant magnesium deficiency. And this matters enormously, because magnesium regulates the calcium channels in nerve cell membranes. When magnesium is low, those calcium channels fire excessively, creating exactly the kind of hypersensitivity and spontaneous nerve firing that Thomas was experiencing as electric shocks and burning. Over time, with the right specific nutritional support, Thomas came back and told me something I've heard many times since. I slept through the night. That was it. That was the first thing he said. After 4 years of waking at 3 a.m. with burning feet, he slept through the night. This isn't just about the burning in your feet. I want you to understand what peripheral neuropathy actually takes from a person over time, because I've watched it happen, and it's one of the most heartbreaking things I've seen in clinical practice. It starts with sleep. You cannot sleep through the night. And what happens to a person who doesn't sleep? Their immune system weakens, their mood deteriorates, their cognitive function declines, their ability to heal slows. Everything downstream of quality sleep begins to unravel. The burning at night is not a nuisance symptom. It is a systemic destroyer. Then it takes your confidence. You stop trusting your feet. You stop walking freely. Studies suggest that falls are the leading cause of accidental death in adults over 65, and peripheral neuropathy is among the most significant risk factors for falls, because the feet cannot accurately report ground position to the brain. Every walk to the kitchen is a risk calculation you're running in the background of your mind without even fully realizing it. And then, and this is the one that hits the hardest, it takes your identity. The version of yourself that was active, that gardened, that danced at family gatherings, that got on the floor with the grandchildren, that didn't need to hold the railing or ask for help. I've watched patients grieve the loss of that person quietly, because they don't feel they have permission to say out loud how devastating it is. It's just nerve pain, they tell themselves. But it is not just nerve pain. It is the systematic removal of everything that makes you feel like yourself. And underneath all of it is a fear that most of my patients never say directly, but I see it in every appointment. I don't want to be a burden. I don't want my children to have to take care of me. I worked my whole life to be independent. And this thing happening in my feet is threatening that. That fear is legitimate, and it deserves a real response. Not gabapentin, not capsaicin cream. A real biological response that addresses what is actually happening. If what I'm sharing today is new to you, and I suspect it is, make sure you subscribe to this channel. I release critical health information for people over 60 every week. Information your doctor may not have time to share in a routine appointment. Hit the subscribe button below. It costs nothing. And it could be one of the most important health decisions you make today. I've put together a short presentation that goes much deeper into everything I've covered today. It includes specific approaches that I've seen work for patients in exactly this situation. The link is in the description below. Watch it when you have a quiet moment. I think it's going to answer a lot of questions you didn't even know you had. Let me tell you about the specific nutritional compounds that the research increasingly points to as meaningful support for peripheral nerve health. I'm not going to tell you these are cures. What I am going to tell you is what the data shows, what clinical evidence points to, and what I've observed in patients over decades of practice. The first and most critical is methylcobalamin, the neurologically active form of vitamin B12, not cyanocobalamin. This distinction matters more than almost anything else I can tell you today. The research on methylcobalamin is extensive. It is the form of B12 that crosses directly into nerve tissue. It is the specific form required for myelin synthesis. And the vast majority of B12 supplements sold in pharmacies and grocery stores use cyanocobalamin, the cheaper, synthetic form that requires a conversion step many people over 60 cannot adequately perform. Clinical evidence points clearly to the superiority of methylcobalamin for nerve health support. If you are taking B12 and it isn't working, this is almost certainly why. The dose matters too. What researchers have observed as clinically relevant for nerve support is far higher than what most multivitamins contain. This is one of the most researched natural compounds for peripheral nerve support, and the gap between what most people are getting and what the research suggests is needed is significant. The second compound is alpha-lipoic acid. This is a fat-soluble antioxidant with a remarkable property. It works specifically inside nerve cell mitochondria. Standard antioxidants, vitamin C, vitamin E, cannot cross into the internal environment of the nerve cell at meaningful concentrations. Alpha-lipoic acid does. It neutralizes oxidative damage at the source, and the nerve mitochondria, those internal power plants I described, need that protection. Researchers have observed that alpha-lipoic acid supplementation is associated with improvements in nerve conduction parameters. What the data shows is that this compound reaches a place that nothing else does: the burning sensation, the electric jolts. These are outputs of mitochondrial dysfunction. Alpha-lipoic acid supports the machinery that drives them. The third compound is benfotiamine, the fat-soluble form of vitamin B1. Here's why this specific form matters. Standard thiamine, the water-soluble B1 found in most supplements, does not penetrate nerve tissue effectively. Benfotiamine does, and its specific mechanism of action involves protecting nerve cells from damage caused by elevated glucose, even in people who are not formally diabetic but have prediabetes or blood sugar dysregulation. The research on benfotiamine has been conducted in European clinical settings for decades. What the clinical evidence points to is that this compound provides a layer of nerve protection that is simply not available from standard thiamine. For anyone with any degree of blood sugar challenge, and that is the majority of people over 60, benfotiamine represents something the research suggests their nerves are not getting. I also want to address magnesium, because what the data shows is that the majority of people over 60 are significantly deficient in magnesium, and that deficiency directly worsens nerve hypersensitivity. Magnesium is involved in regulating the calcium channels in nerve cell membranes. When magnesium is deficient, those channels fire excessively. That excessive firing is experienced as electric shocks, burning, and hypersensitivity to touch. Researchers have observed a well-established role for magnesium in neuromuscular function and nerve signal regulation that has not received nearly enough clinical attention. The form of magnesium matters here too. Magnesium glycinate is far better absorbed than magnesium oxide, which is what most cheap supplements contain. Now, here is something that I think deserves to be said plainly. Why hasn't your doctor talked to you about any of this? This isn't a conspiracy, it's a system problem. A physician in a standard clinical setting has between 8 and 12 minutes with you. In that time, they need to review your chart, address your primary complaint, manage any acute issues, and document the visit. There is no framework in conventional medical training for nutritional biochemistry at the level of nerve cell mitochondria. There is no reimbursement code for discussing methylcobalamin versus cyanocobalamin. The pharmaceutical model provides medications, many of which, like gabapentin, address the signal but accelerate the underlying damage over time. The result is that millions of people over 60 are suffering from something that published research addresses in significant depth, and they are never told. What most doctors won't tell you in a 10-minute appointment is not because they don't care. It's because the system they operate inside doesn't reward this level of information transfer. And the patients who need it most, people like you, who are already suffering, already frustrated, already looking for real answers, are the ones left to find it on their own. You are not powerless here. I want you to hear that clearly. The peripheral nervous system has a remarkable documented capacity to begin recovery when given the specific nutritional environment it has been missing. The research on this is clear. It rarely reaches the people who need it most, but it is clear. Myelin can be synthesized. Oxidative damage can be countered. Nerve cell energy production can be supported. These are not theoretical possibilities. They are documented biological processes. And the next time you reach for that red pepper seed remedy, or whatever has been giving you some temporary relief at night, I want you to remember what I shared today. Because now you understand what's actually happening at the level of the nerve fiber, you understand why the capsaicin quiets the signal temporarily, and you understand what is needed to actually support the underlying structure that's generating that signal in the first place. You've been patient. You've been trying. You deserve real information. If today's video opened your eyes to something important, share it with someone you care about. Because there are millions of people over 60 dealing with this silently, and they don't have to. The short presentation in the description goes even deeper. I highly recommend watching it when you have a quiet moment. Subscribe for more critical health information every week. And leave a comment below. What was the most surprising thing you learned today? I read every single one.